Hi, this is Jim Sapersky, and welcome to Mental Health Care Today. Our special guest today is a good friend, Dr. Amy Baxter. Amy is the founder and chief executive officer of Pain Care Labs, but more importantly, or as importantly, she is an expert in the field of trypanophobia, which is our word for the day, which involves extreme fear of needles and ironically affects 50 million people in the United States today. It is listed in the DSM, the Bible for psychiatry, as one of the top 10 fears and listed as a phobia. And Amy has been researching this for years and years. She started as an NIH-funded drug-free pain relief expert, looking at vaccinations early on. She's doing a lot of work with NIH study today, looking at back pain. She holds multiple patents in the fields of neuromodulation and mechanical stimulation, which really is the use of cold and hot thermal applied to high frequency vibration for non-opioid pain relief, another hot topic in today's world where opioid use has gone off the scale. Amy recently testified at the Health and Human Services Vaccine Advisory Panel on the fear of needles and the impact that would have with the pandemic and vaccinations going on. So it's a very relevant topic today. Amy, welcome. And before we start about injections and needles, how did you end up researching low back pain and needle fears? Where did this start?
How do these two strange things connect? Well, first of all, Jim, thank you so much. It's nice to see you, my friend. I'd always been interested as a pediatric emergency doctor in preventable pain and certainly fast-acting solutions. So I initially began researching ways to decrease the pain of injections. And it turns out if you can block a needle in a little kid, then you can address a knee pain in a total knee replacement. So the mechanisms, I'm sorry about all those syllables I made you put together. Neuromodulation is just using one signal through your nerves to block another. So it can, if you bump your elbow and you rub it, that's neuromodulation when you get the pain decreased. Or if you bump your hand with a hammer and you wave it, that's also neuromodulation. So people think about electrical stimulation devices or hot or cold, but we're using mechanical stimulation. And so it turns out you can use it for needles or you can use it for low back pain or knees. So right now I'm studying different frequencies of vibration, mechanical stimulation, and temperature to block low back pain to reduce opioids, but it started long ago with a little vibrating bee for needles.
Buzzy, which I'm very familiar with, and it's seen, and by the way, is used in children's hospitals around the world to help them with child and adolescent vaccinations. So Amy's done some really great work in that area. And Amy, what are some of the symptoms of needle fear, both in children and adults? I mean, what do you see and how does it manifest itself beyond the fact that we show up at the doctors and some of us, like myself, perhaps break out into a cold sweat?
Sure. Well, like many things, it's a spectrum. And it's not just a one thing or another, which is how psychiatry works, right? You've got a whole bunch of different criteria and you have to get enough criteria to hit the threshold where you need to do something. Needle fear is a little different because there have only been needles for a couple hundred years. So this is not something that as a race we have grown up learning how to, human race, how to avoid or to worry about or to survive. It's a special thing. It turns out it starts for most people between the ages of 4 and 6, which is when a lot of phobias start. Something happens that makes you afraid, but you're not able cognitively to abstract what the meaning of that is. So this means that a lot of children will take the meaning from how their parents act, but they also are old enough to remember. So if they're being held down, if their parents are upset and they're getting hurt over and over again, it's not surprising that they will go on into adulthood not liking needles.
Interesting. And one thing I remember you've told me before, because one of my questions was, when did you first notice this? And why does it seem to be more of an issue now, perhaps, than when at least me, Jim Sapersky, quite older than you, grew up? And why is it seeing it manifested so much more today than it was 30, 40 years ago?
Right. When I started researching this, we didn't have a really good theory as to why needle fear was increased. We were testing the Buzzy pain relief device for vaccinations, and our 10 to 12-year-olds said that they were afraid of needles in a much higher than expected percent. In fact, 95% of them had some degree of needle fear. And previously, it had only been 25% that had been published. So we knew something was up, and the theories ranged from children are weak these days to coddling parents to helicopter parents to too much reality television and video games. It turns out that while you can correlate a lot of different things that are different about our society, the main difference, Jim, you and I were born before 1982. So when we were born, we didn't get those 4 to 6 year old boosters. They just didn't do boosters yet. They didn't realize that's how the immune system best protects you. Since 1982, we've gone up to the place where 4 to 6 year olds get 7 injections during that window. Unfortunately, a lot of times in a zeal to protect kids or to get it all over with, or just in case they don't come back, children were getting 5 shots on one day. And so that has only happened as recently as the year 2000, because in 2000 we changed to injected polio, we have a flu vaccine every year. So starting in 2000, kids born in that year, 63% of them are afraid of needles.
Is this unique to the U.S. or is this on a kind of a global scale? Are we much more pampered in the U.S. than we are on the global scale, or is this universal?
Well, what's interesting is, and this kind of supports the theory that it's because of a traumatic event between age 4 and 6, it's the same in all the countries that use the Western scale, so, or the Western vaccination schema. So Canada, UK, Australia, Japan, all of them do the same vaccination schedule roughly that we do, and they've got very similar rates of needle fear in the children who were born when they started using it. Now, China, there is not that much needle fear. They didn't adopt the Western CDC vaccine schedule until 2008. So it's one of the reasons that we don't see as much vaccine fear there. We also don't see it as much in a lot of places, a lot of countries in Africa, because many of them have a vaccination schedule that is a little bit less codified, and some of it's more dependent on vaccines being given when you can give them rather than having a specific schedule. So it's a little different depending on where you are.
Interesting. Now, more recently, we mentioned this in the outset, you testified at the HHS Vaccine Advisory Panel, and it's near and dear to all of us because we're in the face of a pandemic. Vaccinations are front and center. What is the impact? What have you seen? Can you tell us some of the conversations that occurred in your testimony?
Sure. Well, 2 interesting things about vaccine refusal. The World Health Organization has put vaccine hesitancy as one of the top threats to public health. But what people don't realize is that needle fear is very intimately tied to vaccine refusal. Anna Taddeo in 2012, which was right around when we were doing our studies and we're like, oh my, this fear level is off the charts. What's going on? She found the same 63% of kids afraid of needles in her study. But she also talked to the adults and found that 24% of the parents were afraid of needles. And of those, 7% said they weren't going to vaccinate their own children. So subsequent studies have found that about 50% of people that say that they don't trust vaccines actually don't like needles. They'll take an oral vaccine, but they don't want the needle. And so it's a little easier to say something feels wrong about this when it's really that you're getting hurt, which obviously something feels wrong. The problem is that now we have 20% of people who say they won't get the COVID vaccine, 17% who say they might not, and a number, about 40% of adults who don't come back for the second vaccine when you have a 2 vaccine series. There's been a lot of work done with adults giving blood, trying to predict what goes into the decision to come back a second time. So with all of that together, you have about 67% of the population who may or may not get 2 doses of the vaccine. So the reason I was testifying was to explain that there is this spectrum, that needle pain is not the issue for a lot of people. It's just panic that they can't explain. It's a phobia because they were too young to understand why they were so upset when they had all those injections back to back. But now they're embarrassed, ashamed, and panic. So that fear is very intense. For some of those people, Buzzy helps. Buzzy is the only device or intervention at all that has been proven to reduce fear in adults and kids. The reason it reduces fear is because it has components of control, it has the fainting blocking mechanism, and it also blocks pain. The fainting part is what a lot of people assume goes along with severe fear, but the reality is that they're Venn diagrams, but they don't have to overlap. So some people are very afraid but don't get any lightheaded or sick feelings. Some people only get fainting feelings or even pass out, but they're not afraid, they're just annoyed.
Interesting. Well, I know, just changing topics slightly, you've spent the last decade building up pain care labs, and the work you do in non-opioid pain relief is really significant. Can you just tell me a little bit, tell our audience a little bit about some of the products you provide and what they specifically address?
I think that we are seeing a commercial and a consumerization of healthcare. There are more people who don't get provided what they need from their health insurance or from their doctors or from the Medicaid or Medicare, and they're taking their health into their own hands. So in our case, it's very literally. We discovered a specific frequency that blanks out pain in the same way that noise canceling headphones can blank out noise. Doesn't mean it's 100%, depends on how big the stimulus is, but when you've got the right frequency of a nerve that can override pain, that can work for a needle, that can work for knee. So the opioid part came when one of my colleagues used the Buzzy device for his knee replacement. He had been in opioid recovery for 20 years. And so he said, can this little bee buzz and use vibration and cold to block my knee pain? And it worked. He didn't take any opioids. So that was when I decided to quit practicing medicine and move from focusing on needles and vaccines to instead making a way that it was easy to put the Buzzy frequency device into a knee unit, so it's a little vibracle device, and use it to block pain so that you wouldn't need to take opioids. So one of the big parts of what we're doing with pain relief is empowerment. We're decreasing fear. We're giving patients power over pain by having a device that's effective in canceling pain that they can put on and they know it works on contact. But it also is a part of a more comprehensive plan after surgery or when you're trying to get off of opioids to incorporate different modalities, heat, cold, vibration, stretching, pressure, to have different options to block pain so you can get through the worst part without having to take opioids.
That's great. That's great. And understanding, as we do, that needle fear and fear in general and pain are really big drivers of mental health issues. Are there any suggestions or the things that we can do differently? We're always big at nView on screening people and trying to get ahead of some of these issues. What are some suggestions you might have?
It's a great question because the work of a guy named Chris France, the one I mentioned, who was looking at whether people come back to give blood a second time, what he found was the most helpful for people that faint with needles is screening, is asking, how afraid are you of having blood drawn out of your arm? People were very loath to talk about needle fear or mention needles because they were afraid it might trigger it in the patients who did have fainting or fear of needles. It turns out that what they needed was just someone to ask, are you afraid of having blood come out of your arm? Because then once that initial screening was done, it enabled the patient to be able to say what worked for them, what their problems were. It enables the caregiver to say, oh, we can address that. Here's how we'll deal with this. So I think, like with many things, until you ask, you can't address the problem.
Amy, thank you so much for being on Mental Health Care today. If anyone listening would like to learn more about what you're doing at Pain Care Labs, can you point them in a direction or how best to get in touch with you?
Sure, and thank you so much for having me. I love talking to you anytime. I am Amy Baxter, MD on Twitter. Our company is www.paincarelabs.com. We have the devices Buzzy for needle pain, VibraCool Extended for knee pain, VibraCool Easy Fit for elbow, and Plantar for, crazily enough, plantar fasciitis. But any of those units can be gotten on Amazon or our Pain Care Labs website. Thank you so much for having me, Jim.
Amy, thanks for being on. And for those of you who enjoyed today's session and would like to subscribe, please do so. Thank you for being with us on Mental Health Care Today. We look forward to seeing you again next time.